Good afternoon, everyone. Thank you for joining us today for our May Arizona Community Grand Rounds. I'm going to give it just another minute for everyone to be able to join us before we get started. Okay, I think we can go ahead and get started. I see some people still trickling in, but welcome and thank you all again for joining us for our May Arizona Community Grand Rounds on mitigating heat-related health risk in Arizona. It's a great topic for right now with the heat definitely kicking in. I'm Dr. Sherry Brown, and I will be your facilitator today. This is a timely and very popular topic, so I'm excited to dive into this session today and hear from our fantastic experts. We will have CEUs available at the end of the session for you guys to provide feedback and obtain the CEU credit. I'd like to first introduce the team of speakers who will be sharing their insights with us today. We have Dr. Eugene Livar, Arizona Department of Health Services. And Dr. Livar in 2024 became the Arizona first Chief Health Officer and Assistant Director of Public Health Resiliency, Environment, and Policy. He oversees the implementation of Governor Hobbs' Extreme Heat Preparedness Plan. He's an epidemiologist who began public health work at Arizona Department of Health Services in 2012. He assists in efforts covering border health and unexplained deaths, and most recently, he was the Assistant Director of Public Health Preparedness, overseeing 6 critical public health bureaus. We also have today joining us Dr. David Hondula. He's the Director of the Office of Heat Response and Mitigation for the City of Phoenix. In this role, he helps coordinate and implement programs to protect people from dangerous summer heat and to improve quality of life. He works closely with local, regional, and state authorities on the development and implementation for the administration of nearly 20 million in public investments to support heat resiliency and coordinate the city's heat response and shade plan. Dr. Hondula holds a faculty appointment at ASU's School of Geographical Sciences and Urban Planning, and his scholarly work on extreme heat includes more than 100 peer-reviewed research articles and technical reports. He earned his Ph.D. in environmental sciences from the University of Virginia and is proud to call Arizona home with his wife and sons. Our last speaker today is Sam Johnson. She is the program manager at Elaine, Arizona. Elaine AZ is a nonprofit providing no-cost transportation to vulnerable populations across Maricopa County who have systemic barriers to care. Since joining the team in 2022, Sam has helped scale operations and strengthen partnerships across healthcare, public agencies, and social services. Their work supports statewide initiatives addressing transportation as a social determinant of health, with a particular focus on heat mitigation and care continuity. Sam brings over 10 years of experience in mental health advocacy and disability services to Elaine AZ's work. On our next slide, I'm just going to read briefly our financial disclosures. So all planners and speakers, presenters of the training today and presentation about to take place have no relevant financial relationships to disclose. Arizona Alliance for Community Health Centers is accredited by the Arizona Medical Association to provide continuing medical education for physicians. The Arizona Alliance for Community Health Centers designates the Arizona Community Grand Rounds mitigating heat-related health risks in Arizona educational activity for a maximum of 1 AMA PRA Category 1 credits. Please feel free to use the question and answer function to send questions our way throughout the presentation. After each of our presenters have provided their initial comments, we will then begin answering questions at the end of the presentation. With that, I'll turn it over to our esteemed panel. Dr. Livar, please take it away.
Thank you so much, Dr. Brown, and I'm so grateful for the invitation to speak today and cover a little bit of information about the state approach to heat. Next slide, please. Well, I wanted to go ahead and begin with just a little bit of groundwork about the weather and temperatures that we've been seeing within our state. While 2023 was a summer to remember, NASA declared 2024 the hottest summer to date, highlighting a concerning trend that we've been seeing for decades in Arizona. In Arizona, we risk becoming desensitized to such extreme heat, underscored by the National Weather Service graphic showing significant 2024 temperature departures from normal. Looking forward to 2025, the National Weather Service predicts a continued trend towards above normal temperatures across the state. However, there's a slight trend towards above normal precipitation for the state during the monsoon season. If we experience a more active thunderstorm season, as the trend suggests, it could lead to slightly cooler, though still above normal conditions, hopefully preventing another outlier record around heat that we saw in 2023 and in 2024. Next slide, please. I realize many of you who joined today are likely already familiar with this, but climate drivers are making a real impact on our health by changing how often and how intensely we experience weather events like heat waves and heavy rainfall, especially in Arizona. These shifts mean that health issues we already deal with in our communities are likely to get worse, and we might also see new health risks pop up, like toxic algae blooms, waterborne diseases, in places that haven't faced these problems before. On top of that, people and communities could hit multiple climate-related challenges at once, leading to an even bigger health impact. Basically, extreme weather not only ramp up current health concerns linked to the weather, but also bring unexpected challenges to new areas. For those in healthcare, grasping these evolving health risks is key for taking care of our patients and preparing for public health needs. Next slide, please. Okay, so looking at heat-related illness numbers that we saw jump a little bit in 2024 to over 5,900 cases, compared to just over 4,400 cases in 2023. Though we did track for a couple more weeks and had better awareness, may be a reason why we saw an increase in those numbers through educational campaigns, outreach, and efforts with community partners across the board and within the state. On heat-related death front for Arizona, the numbers actually held steady and even dipped slightly to 976 in 2024, compared to 990 in 2023, which is the first time we've seen that happen in our state since 2018, which is a kudos to all the hard work that's getting done on a local level across Arizona. Increasingly, fewer of those who died had been long-term Arizona residents compared to last year, which might indicate local outreach is working. While illnesses went up, this pause or slight dip in fatalities statewide is a really noteworthy development. Next slide, please. So we've been making some real strides with the governor's 2024 Extreme Heat Preparedness Plan, especially in getting funds like $9 million for mutual aid and FEMA support lined up to tackle the heat head on. On the shelter front, we've been busy distributing energy assistance, expanding emergency shelter funding, and even hired a dedicated heat relief coordinator for the state, and pinpointed key spots for heat relief efforts. We're also boosting energy resilience with grants for rural grid upgrades and getting our utility providers on the same page. While in health, we've set up a new heat response thresholds, developed public-facing heat-related illness dashboards, and made sure our inmates and state employees have safety measures in place. These short-term wins, along with beefing up our disaster response and community support, are all about getting Arizona better prepared and more coordinated for when things heat up. Next slide, please. As we look ahead to 2025, our main focus is to streamline our heat preparedness efforts. We'll continue our collaboration with both federal and state partners, which is crucial for effective planning. Another key step is transitioning to an online platform and utilizing topic-specific task forces to tackle challenges more efficiently. We'll also be updating our public health heat strategies to ensure they reflect the latest insights and needs. And overall, we aim to enhance engagement and foster greater collaboration to make a real impact in our heat preparedness initiatives. Next slide, please. We're excited to share that our updated ADHS heat strategies will be coming soon for public release and distribution. An online application roundtable will also be introduced, as mentioned, to help facilitate connections. Our work group and task forces will focus on their goals and objectives to ensure we're all aligned. We'll also connect with community partners and host listening sessions to gather valuable feedback. We're coordinating with partners to finalize toolkits to help keep everyone prepared for the heat. And a big part of our effort is working towards the recognition of heat as a natural disaster. We're gearing up for the third annual Heat Summit, which will bring together even more voices to tackle this important issue after heat season. Plus, you can check out more information and resources at our new website, heat.az.gov. Next slide, please. So I wanted to go into a little bit more about this website and a few key resources that may be useful for this audience. The website heat.az.gov is a new resource for Arizonans looking to stay safe during the intense summer heat. It offers practical tips on how to remain cool and hydrated, recognize heat-related illness symptoms, and even provides first aid measures. It contains features like an interactive map of cooling centers and guidance tailored for vulnerable populations, including the elderly, children, outdoor workers, and more. It's all about empowering people to make informed choices. By focusing on education and easy-to-share materials, the site helps ensure that everyone is aware of the steps they can take to avoid heat-related illness. Next slide. Some of the other resources that may be valuable to you and those who are on the webinar are the CDC's Heat Risk Tool. This is a great resource providing essential information on staying safe during extreme heat events in Arizona. On this slide, one side shows the front page and the other shows the information it gives when you're entering in your zip code. The site offers helpful tips on recognizing signs of heat-related illness and advice for protecting vulnerable groups. By exploring the resource, individuals can empower themselves and their communities to take proactive steps to reduce risk associated with extreme heat. Next slide. I wanted to share this ADHS heat-related illness dashboard. It provides data on emergency department visits for heat-related illnesses in our state, along with demographic information like age, gender, race, and ethnicity. This year, a cool new feature is that the data is updated 3 times a week on Mondays, Wednesdays, and Fridays throughout heat season, so you can stay informed about the latest heat illness trends within your jurisdiction. Next slide. During Arizona's heat season, a tiered system helps communicate different heat danger levels to the public based on the National Weather Service heat risk forecast in unison with heat-related illness emergency department visits, heat-related EMS dispatch data, and local jurisdiction needs and capacity. This system prompts specific safety measures tailored to the predicted intensity of heat and the potential impacts on health. You can check the ADHS heat tier dashboard for the current status of heat tiers in your county, ensuring you're always informed. Just for a heads up, the tiers utilized are Tier 1, which is heat season that we're in now, Tier 1A, which is a cautionary period, Tier 1B, which is exceptional heat events, Tier 1C, which is multiple emergencies occurring simultaneously, and Tier 1D, which is recovery. You can find more information in our ADHS recommendation and findings for the Extreme Heat Preparedness Plan in links that we'll be sharing later. Next slide, please. Arizona provides a statewide interactive map for showcasing cooling centers, hydration stations, and respite locations, which is a collaborative effort involving ADHS and local partners. The heat relief map is regularly updated throughout heat season to ensure residents have access to current information. The accuracy and comprehensiveness of the map rely on ongoing data sharing and coordination with local health departments and organizations across the state, and is a useful resource throughout heat season. Next slide, please. This information sheet is a tool for healthcare providers highlighting how Arizona's extreme heat can seriously impact patients taking certain common medications, and it was developed in partnership with U of A's Heat and Medications Task Force. It explains that some drugs can affect the body's ability to cope with heat or increase sun sensitivity, and even provides a specific list of medications to be aware of. This guide is intended to help identify at-risk patients, adjust care plans when needed, and counsel them on staying safe when the temperatures soar. Through these efforts, we were also able to partner with Arizona Poison and Drug Information Center to be available and assist providing information to healthcare providers and the general public on medications and heat impacts in English and Spanish through their 1-800-222-1222 line. Next slide, please. This is a quick preview of a resource that we'll soon have handy and available to all. What it does, it has an additional list of medications that can be affected by heat, and it'll be available in both English and Spanish, so it's easy to share. This upcoming resource will also include useful support numbers like 988, Arizona Poison Control, and the Opioid Assistance Line, all in one place for easy reference. And we'll be happy to share this through our website and also with Blue Cross Blue Shield so that we can get it out to the attendees of the call when it is ready and distributed. Next slide, please. All right. So this is our Let's Beat Arizona Heat by remembering a few key things and a few key messages, including keeping cool, drinking plenty of water, and stay sunwise when you're out and about. Don't forget to stay informed about the weather and keep connected by checking in on your family, friends, and neighbors to make sure that they're doing okay too. Next slide, please. Here's a QR code to register for our online application and our monitored inbox so that you can stay connected and informed during heat season. And this will be a main way that we'll be distributing information and updates to our extreme heat partners and stakeholders across the state this summer. Next slide, please. So I know I went over a lot of information and a lot of resources. So we'll be including resources with these slides, and we can also make the list available to anybody who's interested. As you saw, the inbox at azheat at azdhs.gov is one place to request any information that you're needing, or if you have any suggestions for what we can provide to you to help keep you informed and aware of what's going on during heat season in the state. Next slide, please. Thank you for the opportunity to present today. I hope some of the information was useful to you and gave you a little bit of insight to what we saw in 24, what we're doing in 25, and some of the resources that we have available to assist you and community members moving forward. Thank you.
Thank you so much, Dr. Livar, for presenting. We really appreciate the useful information. I'm going to turn it over to Dr. Hondula now for his portion.
Thanks, Dr. Brown and Dr. Livar. Always fantastic to hear from you. Looking forward to complementing what we heard from Dr. Livar with a perspective from one of the many local governments and teams working in communities that Dr. Livar referred to all across Arizona to try to keep our residents safe. And I'm going to organize my prepared remarks today within the context of the city's heat response plan. This is an annual plan that the city has authored and our city council has approved in each of the last 4 years. It's a document that improves every year as we continue to learn in partnership with so many of you. Before we talk about the heat response plan, which focuses on our summer safety strategies, we can go ahead to the next slide. I just wanted to introduce for the audience who may not be aware, I represent the Office of Heat Response and Mitigation at the city. We're part of the city manager's office, team intended to think strategically across the whole organization about how we can create a Phoenix of the future that's safer and cooler and more comfortable for everyone. And our work is quite broad in the heat office, spanning certainly the safety focused topics we'll talk about today, but also topics related to longer term heat mitigation. And you can see just a couple of samples of the types of projects and initiatives we're thinking about on the long-term front. More engineered shade in the environment, more natural shade, of course, and also thinking about how we can adapt our buildings and surfaces to be more heat resilient. This is work that happens in coordination with many other city departments and partners across the community and state as well. But on to the heat response plan on the next slide. Thank you. Our heat response plan is organized into 8 different focus areas that you can see on the slide here. There are something like 30 to 35 specific actions that address these 8 strategic priorities. And I think these overlap a lot with what we heard from Dr. Livar, showing the alignment that we have across different levels of government and thinking about heat here in Arizona. This is a plan that, as we go to the next slide, is really a team effort. with many of you in the community, and certainly many individuals and many organizations. Just a sample shown on the slide here, and we're grateful for the input of all these partners. And on the next slide, many city departments as well. In fact, I think one of the hardest parts, I don't know if Dr. Livar would agree, but I find one of the hardest parts of being in this new job working in the heat space is to try to understand where the boundaries of our work might end, because heat is such an intersectional topic. And I think it's actually quite hard to find a department or agency that isn't relevant to the heat challenge in one way or another. And we've really tried to be as inclusive as possible, because we know that our success in reducing heat illnesses and deaths and achieving our other desired outputs is going to be dependent on the expertise and resources of a really wide berth of agencies and departments. We can go ahead to the next slide. I'll just briefly parallel here a little bit of what we heard from Dr. Livar with a focus on Maricopa County. For anyone joining not from Arizona, Maricopa County, the most populous in the state, home to Phoenix and the Phoenix metropolitan area. And in Maricopa County, we're really blessed that our health department and Office of Medical Examiner operate what I consider to be the national gold standard for a heat mortality surveillance program. We wish we didn't have such quality data. We have such quality data in part because we have so many cases. But given that this is a big challenge, it is a real resource to have such a great surveillance program to provide intelligence that can drive our actions. And just for some examples of what's contained in the mortality reports from our county health department, information about place of exposure and place of injury. In Maricopa County, about 3/4 of cases in recent years have had an outdoor place of exposure. Not 100%, notably. About 1/4 of cases have an indoor place of exposure. So if we're only thinking about people who are hot and struggling outside, we're missing a big piece of the pie. As we go to the next slide, we also recognize that certain groups, as Dr. Livar referred to, have particularly high risks. And in the city of Phoenix and in Maricopa County, our neighbors experiencing homelessness, in particular unsheltered homelessness, are at very high risk. Last year, the bar on the far right of this slide in Maricopa County, we had about half of our heat-related deaths were among people experiencing homelessness. If we were to translate that into some type of relative risk compared to the rest of the population, we'd be talking about a 300 times, not percent, 300 times higher risk than the rest of the population, because of course people experiencing homelessness don't account for half the population of Maricopa County, nowhere close. So if we want to make meaningful change in moving these numbers, the totals down, more than 600 heat-related deaths in Maricopa County last year, we need to be focused on our neighbors experiencing homelessness and other populations that are particularly disproportionately impacted. We can go ahead to the next slide. Dr. Livar talked about heat risk in his slides as well. And just want to highlight one other way that we think that this heat risk tool is so important to drive action in Phoenix and in Maricopa County and in Arizona. And bear with me for a moment. I'll walk you through what is a little bit of a complex figure. This is in the County Health Department's 2024 report for those who are interested to look at it a little more slowly than we'll have the time to do today. We're looking at information from every day in the 2024 heat season on the graph. The lines at the top show the daily maximum and minimum temperatures, and the height of the bars shows how many heat-related deaths were reported on those days. And the bars are colored based on the heat risk category of that day. So for example, the purple bars are the most dangerous days. Those that are classified as extreme heat risk. But I'd like to draw your attention to how many of the individual days and how many of the bars are coded orange, or some of them even yellow if you have really good eyes. And it turns out that more than half of the heat-related deaths that happened in Maricopa County last year were on those orange days or on those yellow days, days that have some type of lower heat risk, but a risk that's greater than zero. So just as the County Health Department report informs, they're thinking about which populations with whom we need to engage. It also informs when. And the answer for Maricopa County and other jurisdictions in Arizona and all across the Sun Belt is not just during those periods of defined extreme heat warnings, but we really do need to be thinking seasonally. The data here suggests we need to be thinking seasonally, treating heat as a chronic hazard. If we're not thinking about the days that aren't the most extreme, we're going to miss a lot of cases. And last year, we actually would have missed the majority of the cases if we were only focused on those heat warning days. So a tool like heat risk, to be able to communicate that there is risk outside of those most dangerous days, I would argue is essential to our work here in Arizona. Let's go ahead one more slide. And I just wanted to return to the heat response plan to highlight a few examples of the actions that are in the plan to give you all a sense of how we're thinking and what we're doing, and certainly hopeful to receive your input to help improve what we're doing. And I'll highlight a couple of the actions that we implemented last year. Of course, there are some operational changes that we are working on and have already implemented for this year. We're actually 2 weeks into our operational season right now. But to tell a little bit of the story from 2024 as we go ahead to the next slide, uh, one of the components of our heat response plan that has been receiving a lot of national and international attention, and as we understand it, is making a big impact on the health of people in the city of Phoenix, is the cold water immersion treatment that our Phoenix Fire Department paramedics are implementing in the field. When they encounter patients with severe heat symptoms, including heat stroke. You can see what the treatment looks like there on the lower photo. Essentially, the goal here is to get the body cooled as rapidly as possible and have cooling happening while the patient is in transport to a medical facility. And we are hearing anecdotal reports from partners in the healthcare environment that they firmly believe that patients who may not have ever left the hospital or who might have left with severe and permanent disability of some kind because of a severe heat illness are now walking out the door almost unscathed. There's high confidence that the program is saving lives. There's a more formal assessment underway right now, and I know our fire department is communicating with many of you and other agencies across the state to try to improve this technique and share how it is working. And I've just been so impressed with the work of our fire department. More than 300 deployments of this technique last year here, really the front line of defense against heat illness. As we go to the next slide, we're also thinking more upstream about trying to ensure that folks have access to cool space as often as possible so they don't find themselves in the need of a visit from our fire department. Last year, a huge one in the city of Phoenix, we were able to make our first ever investment in a 24/7 as well as an overnight heat respite facility, complementing our work operating typical business hour cooling centers and hydration stations. We repurposed a vacant cafe space in one of our public libraries into a 24/7 heat respite center. Between that and an overnight facility, we recorded, as you can see, nearly 30,000 visits, serving something like 5,000 unique visitors. And I think the magic of the recipe here, why this worked, was the collaboration. Uh, our Office of Homeless Solutions and other partners in the behavioral health, homelessness, health, and medical space provided a comprehensive staffing model, resource model. This was not just a place to go and get out of the heat. It was a place where we were trying to solve upstream challenges that brought people to the heat relief site in the first place. And I'll share more about the impact of that in a few slides. We absolutely learned a lot from this model last year as well. Maybe we'll talk about that in the Q&A. We've moved to a new location for this year that has expanded capacity, but we think we're on the right path. And this was only possible because of investments made not just by the city government, but by the county and state as well. I'm very appreciative. This work, as we go forward to the next slide, was complemented by efforts to extend the operating hours at select city cooling centers. Here in Maricopa County, for those who are not familiar, we have a really strong network of heat relief sites coordinated by our regional planning agency, MAG, and the county health department. Historically, this has been an opt-in voluntary network, which creates some non-optimal behaviors. For example, the heat relief network goes quite dark at the end of traditional business hours. And as we all know in Arizona, it still is quite hot outside then. So we were thankful to be in a position to be able to make the investment last year to extend cooling center hours at a few locations. We'll do that again this year. This year, in fact, we're going to keep the entire library open. Last year, we had a dedicated cooling space. This year, we're going to be able to keep the whole library open with resources available for the whole community at three locations that are targeted in the city based on our heat illness data. And just a couple more examples here of actions in the plan. We can go ahead one more slide, please. Thank you. Uh, there's a lot of work done to distribute water last year, more than 1 million bottles out to the community. This is a collaborative partnership with the county health department and others. I've learned a lot about water logistics and the water supply chain in the few years in this job. We know that the city's reach can only go so far, so we're working through grant programs and other opportunities to get supplies and resources in the hands of other partners that are doing similar work. We certainly do pay attention to the major events that the city hosts to ensure that residents and visitors are safe and not straining our paramedic resources. Last July, for example, Phoenix hosted the WNBA All-Star Game. Those are the photos you see there. And a lot of work to improve what we're doing on the communications front, learning from really public-facing agencies, what will help your clients, your guests, your customers, the people you work with, become as familiar as possible with all of the resources. And these pocket-sized pamphlets were something we heard a lot about last year and wound up being distributed by the thousands. I think I have just 1 or 2 slides left. Thanks for hanging in there. Very quickly on the outcomes. As Dr. Livar referred to, we saw some positive outcomes in our local data. Citywide 911 calls for heat were down last year, 20%, despite the hottest summer on record, and despite a lot of messaging encouraging people to call 911 if they were having a heat emergency. So we feel pretty positive and encouraged by those data. Even a stronger reduction near some of our heat relief sites. We heard about the decline in heat-related deaths for the first time in a decade in Maricopa County. A lot of factors contributing, likely contributing to that number. And what we are really proud of as a city is this last bullet point. Through our heat relief sites, more than 900 people were connected to other types of services, including shelter and housing. Those are really big wins, I would argue, for heat resilience. As we are talking today, there are about 300 people in housing in the city of Phoenix who are there because of engagement that started at a heat relief site. And we know that they will be so much safer this summer. My last comment here is one of appreciation as we go to the next slide. I just included this slide for our emergency manager friends and emergency management oriented colleagues in the audience. Our Office of Emergency Management has really embraced heat as part of their work over the last couple of years, thinking about how do we operationalize emergency response for something that lasts predictably 150 or 180 days. What does it mean to have a planning cycle for that type of event? Maybe we'll get into this more in the question and answer period, but it's really been an important transition for us on my final slide here compared to where we were as a region just 5 years ago. These are comments from a meeting, a public meeting that we held with the state health department. And at this meeting, this was a heat planning meeting, emergency managers, not specific to any one jurisdiction, but emergency managers were standing up saying, I'm not sure I belong in this meeting. I'm not sure heat is in my scope of work. And now, at least in the city of Phoenix, our emergency managers are largely leading components of the heat work. That's the type of governance evolution that we're hoping to see all across the state and country to tackle this really big public health hazard. And Phoenix is very proud to be contributing to that dialogue. Thanks so much for the invitation to be here.
Thank you so much, Dr. Hondula. What a great presentation. Tons of information, and we're so proud of the work you all are doing. I'm going to turn it over to our last speaker, Sam Johnson with Elaine AZ. Thank you.
Thank you so much. And let me just first say what an honor it is to be here representing Elaine. We are just a small cog in the much larger heat mitigation plans, and I'm just delighted to hear about all that is in store for Phoenix this summer. What I want to say is, well, first I'll start. Next slide, please. So Elaine is a very small nonprofit, providing no-cost transportation to people experiencing homelessness in the downtown Phoenix area. We have 4 vehicles. Last year, we did over 9,000 rides for all SDOH related errands. Now, within that, though, we've had a growing awareness of our responsibility to assist in the heat mitigation efforts. As both Dr. Livar and Dr. Hondula emphasized, the people most impacted by extreme heat events are people experiencing homelessness. And I would say in our experience, that's closely followed by homebound seniors on a fixed income. And we actually serve that population as well. Next slide, please. So what I want to do today in this brief time is just give a focus on what a ground level view of heat mitigation can look like. I have here today some heavily de-identified stories of our Elaine clients. These are, fake names, but real circumstances and real temperatures, as you can see at the top. This was just a couple who called our main phone number for transportation last year in May. This was just before the opening of the Maricopa County Heat Relief Network for the summer. So they did not yet, have access to the citywide resources, but what they called 211, and they were referred to us, and we were delighted to get their call. We were able to pick up Joshua and Clara, fake names, at a local Burger King and provide them transportation to the Burton Bar Library, which during the summer is one of the heat relief cooling centers, but is of course all year round still a wonderful place to find some temporary relief from the elements. What was really impactful about this is Joshua and Clara, they were very clearly suffering symptoms of heat exposure. They were trying to find just a place to rest. They were, walking on foot and just trying to find a place to rest and, charge their cellular devices. They were not being allowed to stay at any location that they happened to walk upon. I'm just really, really, really glad that they were referred to us because we were able to provide them that direct transportation from where they were essentially stranded, exposed to the heat, to a safer location. Next slide, please. This story is, again, pseudonyms Tanya D and Marcus, we're sheltering at a bus stop. And I wanted to include this story because one of the barriers that we often see at the ground level to shelter in general and to heat relief is people not wanting to abandon their belongings. It's not received a lot of attention, I think, as one of the barriers to shelter, but it's something that we frequently encounter. And I think if you ask anyone in social services working with people experiencing homelessness, it comes up over and over and over again that people know if they leave their belongings, they're not going to. That's forever, basically. You're not going to have those possessions any longer. We were able to on site take a little time and discuss with them what can you actually carry with you, what's most important. Do you have your documents, your medication, your mobility devices? Because these are the things that gosh, I'm thinking of a circumstance just last week where a gentleman had to abandon a few of his mobility devices because just only so much you can take with you on any given day. But we were able to, like one of the things they had in their car here was an actual television at the bus stop. They left that, and we were able to take them with their important possessions to a local cooling center where they were able to, access food, wash some clothing, and just really, again, find relief and, get connected to resources to start trying to get back on their feet. Next slide, please. So this is another story. Gosh, this one, they actually had tried several times to get into a shelter situation. One of the other barriers that we often see is that, shelters are gender, what's the word I'm looking for? Gender divided. This was a couple living together with their pet, and they were staying actually in a park. On that day that they called us, the first time they called us, it happened to be 115 degrees in Phoenix. And while Mr. B had access to a shelter bed, his girlfriend did not. And I just speaking as any human being in a relationship, if somebody that you care about is unsheltered in 115 degrees and you have access to a cool place to stay, making that choice between do I stay in this location and try to move through the system and try to access resources for the both of us in the future, or do I go back and stay with that person that I care about and make sure that they are safe? That was the choice that Mr. B made, and he chose to go back to the park. And what we were able to do, though, luckily, is provide them with intermittent access to the cooling centers so that the both of them were able to make it through the summer and continue as a couple working through the housing system. Next slide, please. Miss L. So I mentioned that homebound seniors on a fixed income are also one of the most vulnerable populations that we've had the privilege of serving. Miss L called us, I believe also referred by 211. I don't think I included that here. And during her intake, she had actually called us looking for legal resources of all things. But during her intake, we definitely found that she had a need for transportation and several other things as well. She disclosed to us during her intake, this wasn't one of our usual questions, but she disclosed to us that her utilities had recently been shut off. And just, looking out the window that day, and the data from that day shows it was 115 degrees. Given what she disclosed to us, we immediately sent a car to her location and just said, would you like to, go to a restaurant for a few hours, at least until it cools down? And she was very amenable to that. And during that time with her, our driver was able to get her connected with additional resources to follow up. We don't do casework. We focus on providing the transportation, but we're able to make referrals, and we were able to refer her to Arizona Brain Injury Alliance to get her the specialized help that she needed and to follow up with the additional casework, legal support, and utilities assistance that she needed in order to have a safe location to live. Next slide, please. And Douglas, this one I wanted to include because I was personally involved in this one. Our main office is located on the Human Services campus, or sorry, Key Campus downtown. And it's right next to Central Arizona Shelter Services, which is the largest shelter for people experiencing homelessness in Arizona. It is a bit of a maze, I will say. And in the summer, if a gate on the back is left open, we had this gentleman, Douglas, just happened to find his way into the back parking lot of the complex. I happened to go out about 5:30 in the afternoon. It was 117 degrees. And I found Douglas, again, pseudonym, sitting on the curb, his skin he'd clearly been in the sun for quite a long time. He was experiencing visible effects from the heat. He was exhibiting confusion, distress. I spoke with him. He said he was just trying to find the entrance to the shelter before curfew because he knows that at curfew he will no longer have access to a shelter for that night. He's on foot. He just has a backpack. I brought him a water and I just said, I think I can help you with this. He'd been literally in the process of calling 911 and trying to describe to the operator where he is when he doesn't even know where he is, and explain that he's just trying to get to the shelter. The operator's telling him, I can hear the whole thing over the just standing next to him. The operator's telling him they can send an ambulance or a fire truck. And Douglas is saying, no, I don't need that. I just need to be transported to the shelter entrance. And I just, again, felt very, very lucky that we were able to say, here's a car right here. It's literally 2 spaces away. And, despite his, clear distress, the vehicle just being right there and having the problem addressed immediately, getting him transported from just those 6 blocks to where he needed to go, we were able to divert what would have otherwise been an actual emergency from just literally exposure to the heat. Next slide, please. So what I wanted to emphasize is that the barriers that many of our passengers experience for accessing these cooling centers, not knowing they exist, not knowing where they are located, and lack of transportation to reach them. This is from the Maricopa County Department of Public Health last year. But what I want to anecdotally add to this that we've observed, our small team, is that not wanting to leave belongings is an additional barrier, as well as not having access to a phone or electricity to charge your phone. Both of those things we've seen just anecdotally really drive a wedge between the resources that already exist and just getting people into those resources. At Elaine, we've I would call our current approach somewhat of a starfish approach. I don't know if folks have heard the story of walking along the beach and there's all these beach starfish and you throw one back. And the friend asks why you're throwing one back. There are thousands more. And the first person says, well, it mattered to that one starfish. At Elaine, we just have the 4 vehicles. Last year, 9,000 rides. But we do what we can to help the people right in front of us. And while this is not enough right now, I can see this growing. And I think, as Dr. Hondula said, the key is collaboration. You know, we are a small cog in the overall heat mitigation plan right now, but with enough small cogs coming together and providing the necessary pieces, I fully believe that it's possible to ensure the safety and the health of this entire community. Next slide, please. That's it.
Thank you so much, Sam. Very exciting how Elaine is contributing to the heat relief efforts here. I just want to draw everyone's attention to some great related materials we have available. So heat.gov is a really great website. This is Heat Awareness Week, and with the new launch of the website, it's a great resource. So we definitely would love for people to go on the site and get useful information. We'll be including all these links along with the QR codes and all the links the presenters have shown to us today in the post-event email that you should all be receiving as well. Additionally, the Arizona Department of Health Services Director's blog has a website where it has various agencies that have come together to help protect Arizonans against the extreme heat. That's another great resource. And the last resource I really wanted to call out was the Maricopa Association of Governments Heat Relief Network. This went live May 1st, and it's an amazing resource as well. Okay, we are now going to open it up for questions and answers. Our first question is actually for Sam with Elaine. The question is, are there any wheelchair accessible vehicles?
So in our current program, our 4 vehicles do not have wheelchair lifts. Again, we're very small, starting at the grassroots level. However, we do provide transportation for people with fold-up wheelchairs, walkers, canes, basically any mobility device that we're able to physically lift and put in the vehicle on behalf of the person. It is top of our wish list to get a wheelchair accessible vehicle, just putting that out into the universe right now. And all of our drivers are trained via what's it called? The passenger assistance safety and sensitivity training that's offered through Maricopa County. Thank you for offering that. It's really helpful for us. So once we do have access to a wheelchair accessible vehicle, we'll be ready to hit the ground running.
That's incredible. Hopefully soon to come in the future for you all. Next question is around how many cooling centers will allow pets?
Dr. Brown, I could answer from the state cooling center map perspective. So that's fed from several governmental entities and also partners that feed in the information into our state map, such as MAG and some of the others that were mentioned here today. Within the map, if you go there, it does list information such as regular hours, holiday hours, whether or not pets are allowed, if that information is given, wheelchair access and additional services that are offered at the sites. that are listed on the map. I don't have an exact number, but we are looking at ways to post what would be more of a list of the cooling centers and some of the services. So hopefully that's a feature we can look into and make available where we'd be able to dive into that a little easier for the public.
I love that. Thank you for answering that, Dr. Livar. Our next question is, what are ways the community partners and community providers can amplify the cross-sector work of the Extreme Heat Preparedness Plan?
I love this question. I think we can all do our part, right? I think just from my end, and Dave and Sam may have other thoughts on this, is that it does take a village when it comes to extreme heat and how we're going to handle this in Arizona. So we really need people to advocate and also to be partners in spreading the message and awareness. I think what we can do is, if you do have a chance, we'll be sharing links to the extreme heat preparedness plan so that everybody can be aware of what we're looking to do in short and long-term recommendations identified within that plan from Governor Hobbs. And then also just be aware of those resources, know how to interact with those that you're working with, know about those numbers that you can refer them to, as you heard Sam, those connections and can be life-saving that you have. And I think as we look at, as we're connecting with people that may be impacted from extreme heat, whether that's a personal interaction, whether that's when they're going to a cooling center like Dave identified and connecting them to services, or just having that information ready to go, like the 211 number or heat.az.gov, where you can get a bunch of information and resources. Or as a healthcare provider, being aware of those resources that we mentioned, such as the heat and medication sheet, and knowing what that you can let individuals know that they can contact Arizona Poison Control if they have questions about their medications in case they're not able to get a hold of their healthcare provider or their pharmacist and be able to get that guidance. And I think most importantly, one of the big pushes we've done since last year is around community resilience and connection. Check on your neighbor, your family, and your friends. Make sure they're aware of the information that's out there. Make sure that they're in good shape and know those resources and know that they can come to you in case they have any questions. When we talk about isolation, the elderly, those with disability, or other concerns and variables that increase the impact of heat, having that connection and really pushing community resilience is the direction we need to go so that we can have compassion and empathy with those around us. But just my thoughts.
Dr. Brown, if I might compliment Dr. Livar, absolutely want to plus one everything he said. I'll also suggest that engagement with elected leaders and others can go a long way. The landscape of heat governance and heat investment is rapidly changing, and our elected leaders need to know what we are seeing, what we understand the pain points to be, what the costs are that we are incurring in trying to protect people from heat. Uh, and they are going to need our voices and the voice of the public at large to help make arguments to their colleagues in whatever body they represent. So even just an ask of, hey, is anything related to heat on your agenda at all? I think could go a long way, and I think that can be done apolitically.
I love those responses, and you're absolutely right. Anything we can do to raise awareness and be collaborative across the board to make a substantial difference is definitely our goal. So that concludes our question and answer portion. I want to thank you all again, especially to our esteemed panel of speakers today who have shed such great light on mitigating heat-related, health risks in Arizona. The slides in today's recordings will be available on the NARBA Institute's website in the next few days. As we conclude, I'd like to draw your attention to the QR code on the screen. Please use this link to express your interest in obtaining CEUs for today's talk and to provide feedback about what you'd like to see in future sessions. We'll also send the materials and survey links to all participants following this call via the post-event email. As we conclude, I'd also like to extend a thank you to our partners at the NARBA Institute who are instrumental in making Arizona Community Grand Rounds possible, and specifically to Mary Jo Gregory, Dr. Mark Carroll, Jessica Rigler, Carla Berg, and Jennifer Pierce for their collaboration. During the summer months, we will be taking a break from Arizona Community Grand Rounds, and resume our community grand rounds back in fall. So I really want to thank everyone so much for joining. I hope you all have a wonderful summer and you stay cool and hydrated. Have a great day, everyone. Thank you.